Here's how it usually goes. You feel sick, maybe a little lethargic, certainly not your best. Like the cautious person you are, you take an appointment with your primary doctor to see what it's all about. You go to the clinic, they run some tests, and a few days later, you get a phone call. In that phone call, the doctor tells you everything looks fine. Your blood reports came back normal, and there isn't a thing wrong with you. But you still feel sick. So today, we're going to look at how conventional medicine gives a diagnosis as opposed to functional medicine, which essentially looks under the hood to learn the underlying reasons behind your symptoms. Firstly, there's nothing wrong with traditional doctors and medicine. Sometimes it's the right solution to the problem, and it fixes the issue without hiccups. But many times, it prescribes a one solution for all, which is not the most beneficial when your problem is unique. Simply put, conventional medicine merely examines individual symptoms and presumes that they're related to various body parts. This approach to medicine solves the problem at a surface level, looking at a fairly narrow range of factors including family history, previous conditions, and symptoms. Treatment is focused on drugs and therapies when they are not necessary. On the other hand, functional medicine permits you and the physician to examine the symptoms to establish the affected systems in your body. Since holistic medicine won't assign medications for every individual symptom, these doctors can examine your symptoms as a whole to unearth the root source of the problem. By getting to the root source, they can eliminate or decrease numerous symptoms. This is because a lot of patients might have been struggling with something for a very long time, maybe 5, 10, or 15 years. It's hard to get the complete picture by merely running some blood tests. And Dr. Todd Lepine, a guest in Dr. Mark Hyman's video series, talks about how functional medicine essentially helps put the pieces of the picture together. You can't create a picture with just 5 pieces of the puzzle. It'll be 500 pieces before you can make an accurate, understandable picture. Similarly, testing in functional medicine doesn't only include the problem area, it includes everything. They look at all the different systems of the body. Basically, no two people can have the same problem. Even if 2 patients are suffering from migraines, the causes of those migraines aren't the same. Every patient is unique, and that's what Dr. Hyman talks about in a story where he had to treat an 8-year-old with a tic disorder. In addition to that, Dr. Hyman also checked for dandruff, yeast issues, PANDAS, which is a kind of neurological stroke, and even checked whether or not the kid loved sushi, because he might have eaten mercury-laden tuna. It's only a small list of everything he examined, and it's certainly not something conventional doctors would pursue. And it's essential that they do, because everything in the body is connected, making it one big network. When those networks get out of balance, you get a disease. And when they remain balanced, you stay healthy. The key to understanding the issue is knowing what upset that balance, whether it's too much or too little of something. But how do you assess these networks? Functional medicine approaches diagnosis very differently. Aside from conventional lab testing, they also look under the hood to learn about underlying issues that might be causing your symptoms. This is something most traditional doctors miss. So when your lab results come back with no red flags, it's because they haven't really dug deep. But there are some innovative tests that are set to be the future of medicine, and it helps figure out what is really going on. Let's say we have a patient with depression. Conventional medicine views depression as a serotonin deficiency, and that's it. To treat that deficiency, you might take antidepressant medication, but this only solves a part of the issue. Dr. Lepine recounts a case where a young girl was hospitalized for 2 months in a psych hospital. She was on medication for depression, anxiety, sleep, and irritable bowel syndrome, which is a lot of drugs to be on. Dr. Lepine did some toxic and genomic testing, which revealed that she was deficient in amino acids, fatty acids, and magnesium, and had a gluten sensitivity. All of these factors played a role in why her brain wasn't feeling well or wasn't quote-unquote happy, and her doctors were trying to fix all those problems with a pill. Depression isn't just the name of a symptom. It's not the cause or a diagnosis. Often, it could be the result of several factors, including metal toxicity. Now, metal toxicity can have several consequences for the body, affecting the central nervous system and causing disorders, damaging the blood constituents, and damaging the liver, lungs, kidney, and other vital organs. Your doctors might run a simple blood test to look for metals in your bloodstream, but that's not where metal is stored. It's in the body, in the places we don't endeavor to look. Dr. Lepine's methods seek to not only study parts that are less studied by other doctors, but also to pinpoint organic and inorganic metals and differentiate between them to see how differently they impact the patient. These tests help identify whether you're missing something, be it a nutrient or a healthy bacteria in your gut, or if you have too much of something that needs to be cleaned out. They look at genetics, diet, hormone levels, lifestyles, and more. This is called the matrix. After all that, each solution is personalized for the patient. Functional medicine perceives people as unique individuals, with their physiological and genetic makeup. Everyone has different stressors, toxic and environmental exposures, and numerous underlying factors that affect our health status. This approach is a one-on-one partnership between the practitioner and patient. And rather than giving a quick fix, it focuses on creating a lasting path to wellness. A lot of times, this approach can literally reverse issues like diabetes or heart failure, which is simply not possible in traditional or conventional medicine. So, it's no surprise that functional medicine is the future of healthcare. It has increasingly been seen as the new mainstream approach to diagnosis and treatment, one which is patient-orientated rather than disease-orientated. This allows healthcare practitioners to build a better understanding of a particular patient's condition and offer a tailored, therapeutic approach. It relies on not only being aware of the individual's physiological makeup, but also their emotional and cognitive health, as well as their physical functioning. It takes into account the genetics and environment of a person and acknowledges their impact on a patient's health, which only makes sense. Treating one problem doesn't erase another. And when you take a holistic approach to healthcare, you minimize the pills you take and focus on overall wellness, rather than targeting specific issues and staying on medication forever. By focusing on the person, not the disease, functional medicine is showing great promise among those who have received it. So if you've gotten your test results back but still don't feel well, this is a good approach to take to find the underlying issues that don't show up in a run-of-the-mill blood report. While conventional medicine isn't all bad, it's better to take a holistic approach to solve your problem. And a lot of it will have to do with nutrition, your environment, and your lifestyle, which will have far fewer side effects. If you learned something from this video, go ahead and hit the like button. And if you feel inspired to make a change in your lifestyle and look at the big picture when it comes to healthcare, subscribe to our channel for more educational and motivational content. Thanks for watching.